Okay, so here we are. This is such a treat, and I'm so glad that we finally got together on this. You're my second guest, and so this is my chance to introduce you to everyone and tell everyone how much you mean to me.
Oh.
So thanks, Rebecca, for being here. Rebecca Murray is one of my favorite people, favorite clients that I've met. I think it was probably, I don't know, I want to say like 6 or 7 years ago.
Mm-hmm. Yeah.
And we did a little filming together.
Yes, we did.
I
I had a video company back then.
Yes.
Yeah.
Yeah, and your company, Showcase Your Shine. Showcase Your Shine is something that is extremely valuable. Has been really valuable to me as a speaker because it's so important as a dentist to be able to communicate to your clients. So I've learned so much from you. Thank you for being here, and this is such an important moment for me. And so I want to start by saying, thanks for taking the time. It's Friday, and we're here to talk about all different topics: communication, your professional company, helping professionals speak, and helping teams collaborate better. What is more valuable than that right now? I think that is such a force multiplier for my team. I want to have you to Perry University, and we can talk about that as well. But anyway, thank you. And, the first thing I'd like to talk about, if you don't mind, is just what I've learned from you and over the years. So there is another dentist that talks about communication. Retired from dentistry early because of an injury. His name is Paul Homily. He's meant a lot to me in the communication space. Basically, his position is, and he's right, that dentist to patient communication is broken, usually because dentists are trying to get too technical and not really highlighting the benefits of dentistry from a patient perspective. For example, instead of talking about a crown, a veneer, or how it works, we should be talking about how it's going to change your life in terms of your smiling with confidence, or chewing tasty, crunchy foods, which everyone loves. That's like the best part of life. Especially, as you get older, what's for breakfast, what's for lunch, it makes everything more enjoyable, at mealtime when you can be able to use your teeth to function.
Yes, with confidence.
Yeah, with confidence. And so Paul Homily has meant so much to me. I just really want to give him a lot of credit too, because he's been a great influence. He's still active in Arizona. He's in Phoenix. So I really enjoy him. And you're also my local Paul Homily, and a local celebrity. Yeah, that I've had so much of a good time with you together, and I've watched your brand, and I love your graphics as well.
You.
I love the book that you wrote, and it's wonderful. I want to talk about that as well.
Okay, that's great.
So I remember so much of I think photography. You helped with a composite photo of all our team, which we treasure that photo, and the Showcase Your Shine is something that I'm going to integrate into our team culture and in our team to make us more effective to each other. Make us kinder to each other, and I think that's going to really help us get along better. And then also, I'd like to learn a lot more from your program as we can relate to patients better too. Yeah. Because really, I don't see selling dentistry as really difficult if we can find out what people want, because we can help people on all different levels.
Yes.
It just depends on how much time we spend. And so being able to communicate effectively and more get right to it, basically.
Yes. Yeah. And you do such a beautiful job at that.
Oh, well, thanks. I mean, I probably because I know it's important, and so I've been really working on it.
Yes.
I haven't always been the best communicator. I mean, I remember in undergraduate college, I was a chemistry TA. So I was teaching undergraduate students inorganic chemistry. I would have my own lecture on Thursdays. The professor would have lectures every weekday, and then I would summarize and kind of help the students. But what I found out was it wasn't working very well for me, okay? And so...
what do you mean by wasn't working very well?
Well, I couldn't change the way they were absorbing the information.
Mm-hmm.
And maybe I'm not giving myself enough credit because it ended making one or two of the nursing students cry, basically. So
okay.
I think what I said was basically, there's no other way I can explain it. Like this is you just have to understand this.
Oh, I see. Okay,
So
you have to understand it the way I'm communicating it to you, and if you don't, that's your problem.
Kind of, yeah.
Yeah.
You're exactly something like that. I would say I said, hey, if you don't understand it this way, that you just, A plus B equals C,
Yes.
There's no other way of saying it. Yeah.
How did you feel when she was crying?
And I think that was too difficult, too coarse, not kind enough,
yes,
apparently,
right.
obviously.
Lacking empathy a little bit.
Exactly,
Yeah.
yep. And so my boss at the time, which was the coordinator, said to me, I think we're just going to, move you to somewhere else.
I see.
A different role. So...
And did you get that at the time? You understood the reason why? They explained it to you? Maybe you need to learn some interpersonal skills first before coming into this role. It's probably a good thing for them to understand too, because sounds like maybe they didn't support you in enhancing your interpersonal communication skills either.
Well, part of it was young. I was young.
Yes, yes.
And part of it was they just need to make a change, because obviously you don't want to upset other students because this guy is a jerk.
Right.
So
you're making people cry.
The conclusion I came to was that I'm not a good communicator.
I see. Yes, right.
See what I mean?
That belief that you had. Yes.
Right. I formed a belief that I'm not a great communicator.
Mm-hmm.
This isn't my forte. Mm-hmm. This isn't my thing. I should not be doing, I don't consider myself a good communicator.
Wow.
And I also struggled with speech class.
Mm-hmm.
There was a speech course in college that, it's a 100 level course. I had difficulty with that. And also reinforced the belief that I wasn't a great communicator.
Yes, of course. Yes. And most people in that class struggle with it.
Mm-hmm.
Probably a minority did not. Those who maybe had a theater background or in front of audiences with their musical instruments since they were kids, probably had an easier time perhaps with being in front of people and having all eyes on them.
Right.
But I bet you 90% of that class felt exactly like you did.
Yeah, and it was at the time the book was Imagine Your Audience Naked or something like that.
Oh,
yes. Do you remember that book?
Yeah, terrible advice, right.
Yeah, which I didn't understand how that would resonate with anyone. That's hard to do, to imagine that.
And horrifying, really, when you think of it.
Yeah, but that was really showcased at that course. That was like the primary.
Yes.
So we were trying to do that in this course. This is like in the late 90s.
Yes, I remember hearing that once upon a time as well. And I thought, nope, I'm not doing that.
Yeah. But I remember that, and I didn't do well in that class. And so it reinforced this idea that I'm not a great communicator. So over the years, I thought, like, I really need to focus on this,
Yeah.
And the difference between, I wanted to reach my potential as a speaker. So that's why I really enjoyed meeting you and finding out like your skills, and thought, ooh, this is somebody that, I can really learn from.
Yeah. Well, when I first met you, do you remember me telling you?
Mm-mm.
I consider you the dentist to the stars.
Oh, cool.
You're like the Dr. Oz, on Oprah.
That's great.
You belong in Hollywood. you are, in my mind, you are the dentist to the stars. I mean, you have the communication skills. I've always felt supported and educated by you.
Great.
Like the way you explain things in this non-pressure way and help me understand my choices, what's going on in my mouth so that I can make choices for myself.
Nice.
With confidence. That's why I love you.
Thank you.
And your whole staff. I mean, just the experience here, and we'll talk about my 4Crown experience, my spa experience. But I wanted to go back to that time when you were in dentistry, or in school.
Yep.
Because you were also in the military.
Right.
At that same time.
Right.
Right. And the Air Force.
Correct.
The Air Force, yeah. So there's a picture in the office here of you in front of a fighter jet in your flight uniform. Looks so much like Tom Cruise. I mean, that's who you remind me of. We were talking about that this morning, how much, plastic surgery that Tom Cruise has had. Tom Cruise and I are the same age. And that you, like you're a younger version of Tom Cruise who doesn't dye his hair and looks amazing with silver hair. I mean, you really have that Hollywood look about you. But when people see that, and so could you tell the story of how you were sort of deciding between careers, which career you would go? Yeah,
so I was a private pilot, learned to fly during dental school. There's a window where you need to get into pilot training before 26 and a half years old. Oh. It might be 27 years old now. So I needed to decide if I want to pursue this dream of fighter aviation. And so I decided to go for it. I finished dental school, became board certified, and then got my license to practice dentistry before going off to Air Force pilot training. So it's a little bit different. I mean, most of the dentist pilots that I knew were Vietnam vets that came back from war, and then they went to dental school. So that a long time ago, they were pilots. My goal was to be a pilot 1 day a week, and then be a dentist 3 days a week, or 4 days a week. So do it concurrently. What I hadn't figured out is that just the intensity of both careers. Especially fighter pilots' task limit had to go from level 8 to like level 10 or level 11. So I basically learned my Peter principle, which is you get promoted to a level of incompetence.
Right.
Right? And then you go down one level, and that's where you stay in the professional world. That's called the Peter principle.
Right.
And so I had to go and just kind of find my level of incompetence. And so I was in a room full of cadets competing with students. I was a little bit older because I was already a graduate of dental school.
So it was like the Tom Cruise scenario in that movie.
Yeah, just
right?
like that. Just like that.
Yeah.
Yep. And then the room became a little bit smarter, and better looking and stronger and maybe a little bit sharper, both in language and in mental acuity. And the speed just kept going. It would be like similar to like chess, there'd be like chess students in high school.
Yeah.
And then college, and then graduate school, and then the world champion chess players.
Right.
And they're not as nice as the high school chess coach,
Right. Very competitive.
Yeah. And so I got to go through that. And I think that really shaped me, on a professional level. But, I also need to smooth out those rough edges, through communication, because I can be short or just my body language. I would say that if I were to focus on my weaknesses, they would be like softening my body language when I'm frustrated or tired or hungry, you know. So, yeah, and that is probably because I'm thinking about 6 different things.
Yeah,
you know?
exactly.
Yeah, and so I've learned that I'm really good one-on-one.
You are.
I'm probably an introvert because
yes, you are.
Right? I mean,
Yes,
the
you
definition of introvert versus extrovert, I think, has changed for me over the time. My understanding of it was I used to think that it was introvert doesn't like people at all.
Yeah, yes,
but
right.
I think that that's not true. That introvert is really good one-on-one. An extrovert feels more comfortable with a group of 20 or more people. They love to have big groups.
Yeah.
An introvert enjoys more one-on-one. So, and I think our culture encourages everyone to become an extrovert, right? And so introverts are not encouraged perhaps in school, like maybe they should be, but my definition of introvert and extrovert has kind of like changed a little bit. Right?
Well, your chair-side manner, I guess that's what we would call it in dentistry versus bedside manner, is incredible.
Thank you.
Your eye contact, you're calm, you add some humor, and the way you describe things. For example, last time I was in, we were talking about recession. I was asking you, why is it that my gums keep receding? Like it's driving me crazy, and I'm worried that when I get to 80 that my teeth are going to look like skeleton teeth or they're going to fall out or something like that, you know? And you said, have you ever heard that phrase, long in the tooth?
Right.
Yes. And then you just looked at me and I'm like, oh, that's where that came from, right? These people back in, let's say, England without dental care, and as you get older, your teeth get longer because your gums get shorter.
Right.
And since you're sharing that with me, I've shared that with so many people. You know that phrase, long in the tooth? You know where that came from? My dentist told me.
Yeah.
You know, and everybody's like, oh, I never knew that. That makes total sense. So you make me smarter.
Thanks. Yeah. That's a great phrase. It kind of describes what's going on for some people. And, you know, it's going to happen at different levels for different people. You know, like there's going to be a little bit of bone loss over the years. And then the gingival margin, the gum level, they say it changes about 1 millimeter per decade. Okay. And that's a general rule of thumb. 1 millimeter
sounds like a lot.
Yeah. So,
oh my goodness.
Yeah.
That's scary.
Yeah. And you know, it could be a 0.5 millimeter per decade for some people, or near 0 for other people.
Okay. So let's talk about that, because I know, you know, many people probably wonder about this, like as they age. I'm 64. What's happening in my mouth? Like, I don't want to have a smile that looks like where people go, oh, she's long in the tooth. Yeah, right. You know, so what can I
do, right?
Yeah, what can I do to slow this down or prevent it?
So it's multifactorial, meaning there are probably 3 or 4 different factors to control or to consider. One is pressure. Biting, pressure, clenching, grinding. These are all habits that you want to control. Just the big one, clenching or grinding, can be controlled if your brain is happy with how your teeth touch. If there's an interference, or if your teeth are jammed a little bit, which can happen, it can really happen with dentistry. You know, if you get a filling or a crown, it can really throw your bite off a little bit.
Oh, I see.
So you just want to make sure that you have that you've checked that perfectly, and that there's no interference, because the main cause of clenching is an adaptive response. So human adaptive response. Pretty normal. Normal people, almost everyone would have a normal adaptive response to an interference by clenching. So the brain's just trying to figure it out.
I see.
So it's 99% of clenching and grinding is there. It is rare to have a condition where even if you have no interferences, you have a perfect bite, this person can't stop clenching or grinding. But that's very unusual.
Okay.
Very unusual. So that's number one, is just make sure that the pressure's on your teeth, because teeth are held into your skull with a ligament, so that ligament can get, if it's stretched and pulled too much, it can cause bone loss just from pressure.
Okay.
Not even considering the other things, like what is the inflammatory relationship between your oral environment and your body, because the teeth are the only place in your body where there's something sticking out of your skin.
Yeah,
like horns or antlers.
Never thought of it that way.
Yeah, and right on the edge of something sticking out of your skin. It's the only place in the body.
Wow.
Your body has a great way of dealing with that edge there, on that gingival edge, without getting too far in the weeds with the technical stuff. There is really a fantastic, astonishing way that your body has positive and negative electronic charge. Okay, so this polarity of positive and negative can repel bacteria at that edge, at that level. So what this means is, like, some people don't have that very well, and some habits can disrupt that. So, one in particular is smoking. That we can see that from a mile away, and you really see it have an effect because of that. Because of that relationship, it kind of turns that off. So there's
people
a lot
that
of bone
smoke
loss.
have more gum recession.
Yes, definitely.
Wow.
Yeah.
And what other habits besides grinding, misaligned bite and smoking? What else?
Well, I mean, some people are out of shape. Their gum tissue is out of shape. I would say that they need to have it exercised more often.
Like how do we do that? How do we exercise that?
There's all kinds of physical stimulation, like water pick, toothpick.
Oh, really?
Flossing.
Does flossing does that same thing?
Yep, and you have to do it often.
Okay. And so how often is it best to floss after every single meal?
There is no problem flossing at every single meal. I mean, people seem to think that that's bad, or that they shouldn't have to do that. But there's no problem with that. No problem at all. And it actually is quite healthy to do that. So plaque is a bacterial biofilm that's develops after only 12 hours.
12 hours?
Yep. So it's that film that you can feel on your teeth after you haven't brushed for a day or something like that.
Yeah. I mean, not now because I just brushed this morning.
Yeah. So camping trip, maybe you miss brushing and you kind of feel your teeth kind of feel fuzzy.
Right.
That's plaque.
Okay.
And that for sure has to be physically removed. And if you do that and you're exercising your gum tissue, I mean, I think we should all see it as exercise.
Yeah, that's a great way to look at it. So if your gums are out of shape, that you can get them back into shape.
Right, yeah.
By starting this exercise program, basically.
Exactly. If you just have an exercise program, like, you get up in the morning and do push-ups or squats and it's very similar to that. If you have a healthy routine that includes physical stimulation of your gum tissue and removal of the plaque, that can prevent any inflammation right at the edge between the skin and the bone.
Yes.
The bones that are sticking out of your teeth, you could say.
Yeah, right. So what would be, a reasonable for people who don't want to floss 3 times a day and maybe don't even floss now, maybe think about it once a month. What's a way to ease into it? It's sort of like getting a gym membership where, you haven't been at the gym for 2 years and you decide, this is the year I'm getting in shape. And it's hard to start. It's hard to start. So what's a good way to get started for somebody whose gums are out of shape?
So I recommend these flossers that are already wound.
Oh, okay. Like the little plastic things with that my husband uses those. Thanks to you, actually.
Okay, great.
Yeah.
That's wonderful. Thank you.
Yes.
So one of the things I like to tell people is don't throw them away.
Oh, okay. That's great. Because I think about the landfill every time one of those goes in the garbage. Okay, so don't throw them away. Yeah,
and I love surfing. I don't want them showing up on a beach somewhere, like floating through the ocean.
Yes, because they're made of plastic.
So reuse those.
Okay,
which is an enormous help for the environment, right?
Yes.
The reuse part, I think, is like the difficult thing with recycled materials, that if they're not high quality, then the fabric or the fiber can shred, and then it's useless. And then so a flosser that's made out of bamboo with a charcoal fiber that tears the first time you use it.
Right. Yes.
Okay. What good is that?
Exactly. Yeah.
And so that's now probably worse for the environment.
Yes.
But if you have a really high quality fiber that would last, sometimes these flossers will last 6 months to a year.
Just one?
Yeah, of course. Yeah, if you take care of it and you have smooth contacts.
Yes. Oh my gosh. I'm so happy to hear you say this, because now I can tell my husband. It bothers me, he would use one every night. I think like a lot of people do, because they come in a package of 100.
Yeah, exactly.
I mean, there's so many of them in the package. It gives you the impression that they are one use only.
It does. Yeah, you're right. There's a big misconception about that. I would see it like you see a toothbrush. I mean, we reuse our toothbrush, right? We don't throw away our toothbrush after one use.
Yes.
And neither should we do that to these little flossers.
So happy to hear you say that. So let's talk about toothbrushes then. When is it time? We have the electronic toothbrush that I bought, from you directly for your recommendation. And then, my husband still uses the handheld. So and I just actually looked at his the other day. I'm like, Dr. Perry would not be happy with the way this toothbrush looks. So I threw it in the garbage, put a new one in, because I had just come to see you. So the one that you gave me, I put in his little receptacle. And he came in, what happened to my toothbrush? I'm like, it is time for a new toothbrush. So looking at a toothbrush, can we tell by looking at it, or should we go by a calendar to replace the head on the electric one, or to replace the handheld?
That's a good question, because it's going to depend on its use and, how hard you're brushing and the nature of the mouth and there's a lot of factors. But I would say, you should be able to look at it and see if the bristles are bent. I know some companies have indicator bristles that have, like, some of the bristles are colored blue. I think.
Yeah.
And if that's more than half gone, like the color is gone.
Oh, that's smart.
And that'll indicate it's time to replace it.
Yeah. Okay.
Yeah.
That's great.
Yeah.
So going back to this, what I've learned from you over the years. So we've talked about floss, toothbrush. Let's talk about toothpaste, because you go to any toothpaste aisle in any grocery store,
right?
And there have to be 200 or more different types of toothpaste, with fluoride, without fluoride, whitening, sensitive, on and on and on and on.
Yep.
So what is a smart way to choose your toothpaste?
Okay, so teeth are made out of a compound called hydroxyapatite. So that's the buzzword right now with toothpaste.
Hydroxyapatite?
Hydroxyapatite describes calcium phosphate. So calcium phosphate in a very organized crystalline structure, and they call it hydroxyapatite. It defines the combination of calcium and phosphate. This is the glass that your teeth are made out of. So
our teeth are made of glass.
A type of glass. Glass describes, like, for instance, the glass on your car window, or at a window, a clear window would be silica.
Right. Okay.
Right?
Yes.
So they just melt sand to create silica. And so silica molecules are organized so well that they're clear. So enamel, if you were to extract enamel, it would actually be translucent.
Wow.
Just like a window. But that's only the first, or the outside 1.5 millimeters. Sometimes on back teeth, it can be 2 millimeters, maybe even 2.5 at the cusp tip. So enamel can be fairly thick, and in a microscope.
On our molars?
Yeah.
Okay.
On the front teeth, it's thinner, and it's made of hydroxyapatite, the outer surface, the enamel.
Okay.
I call it the chocolate layer, because I describe teeth like M&Ms.
Yes, right.
That's dentin, which is different. Okay. That's similar to a bone, but it's a little bit different than bone.
Is this a peanut M&M where the peanut is the bone?
Well, the peanut would be the blood vessel, I would say.
Oh, okay.
Yeah.
Can we pause there and talk about M&Ms for a second and then get
Sure.
back to the toothpaste?
You bet.
So, because I love this, this is one of the many ways that you have helped me learn things is by your excellent metaphors. You use metaphors in brilliantly to help like the non-dental mind understand what's going on in the mouth, So, and M&Ms was one of those. So, yes,
Yeah,
please continue on the M&Ms. And what color M&Ms are we using here today for the metaphor?
There's always some excellent teacher that I've learned from. Jeff Gray from the Coy Center helped me use the M&M analogy. I got to give credit to him.
Okay, yeah, that's good.
But yeah, I mean, what I say for people that have erosion or like a piece, maybe their gum has receded above, like their teeth used to be wearing a turtleneck and now they're wearing a V-neck sweater, right?
Yes.
That's the long in the tooth thing. Like the whole phrase long in the tooth doesn't mean the teeth have gotten longer, but the gums have become shorter.
I have some V-necks in my mouth, unfortunately. Yeah.
Exactly.
It's sad.
So now the teeth are cold, right? They're like shivering because they're exposed. They got the V-neck. They want a turtleneck.
Yes.
Right. Especially when they go to Switzerland, they're like, wow, I need a turtleneck now, right? Yeah. So I tell people that the chocolate is showing.
Oh, the chocolate is showing because the enamel on the outside of the M&M
Exactly.
is gone.
Well, the enamel ends, and then above the enamel is the chocolate layer.
Right.
Or on lower teeth, you would say, like below the enamel,
yes,
the chocolate would be showing.
Right, the chocolate is showing, yes.
Most of the erosion, they used to call it abfraction, and recently it changed to non-carious cervical lesion.
Oh my gosh, that's a big word.
Right.
Yeah.
Thank
I like
you
M&Ms.
to whoever changed that, right? But it's those little notches on, usually people notice them on the upper side teeth. And
I feel them.
Yep,
I feel
so
it.
that's that's like the chocolate showing right there, okay, of your tooth. So that can become sensitive. And if it's symptomatic, like if it's sensitive, then there's options. It can be sealed or covered.
Oh, it can? Really?
Yep.
Okay. So let's get back to toothpaste, and then I want to go to that because I want to learn more about the erosion.
Now, the toothpaste can actually help with those areas.
Oh, it can?
Yeah, you can treat those in a natural way with toothpaste by remineralizing that chocolate layer.
All right. What toothpaste would help do that and how to use the toothpaste? Because there's something about, I remember that you said about rinsing after we brush our teeth versus not.
I think the most important thing is that we don't rinse.
We don't rinse. See, this was news to me, and it's such a habit to rinse out the toothpaste out of my mouth.
Yeah, and most people don't learn what to do after they brush their teeth, right? They just see their older brother or their older sister do it, and they think that that's the way you should do it. But they haven't had a really in-depth discussion about it. And everyone has different challenges. I would say that it's okay to rinse after brushing if you don't have problems with cavities.
Okay.
But if you have tooth sensitivity or cavities, kind of like...
Or recession,
that's a spectrum, and everyone's somewhere on that spectrum, then not rinsing with water after you just want that hydroxyapatite in the toothpaste to soak into the teeth.
Okay. So when we're looking for a toothpaste, especially those of us who are on the spectrum, then we need to look for that ingredient on the label?
Well, I think that, how like some types of magnesium supplements, magnesium citrate, magnesium glycinate,
right,
or different amino acids are formulated differently.
Yes.
So some of them are more effective than others for certain things. Yeah. So sometimes a toothpaste won't say hydroxyapatite, but its formulation is wonderful. It's great. It works. Toothpaste companies, or like on the label, will say hydroxyapatite now because it's become something that they are looking for that word.
Right. Okay. So, now I am looking for that word.
Just because you don't see hydroxyapatite doesn't mean it's a bad toothpaste. That's kind of what I'm trying to say.
How do we find out, though, if it's not on the label and we happen to like a certain, let's say I'm a Colgate person. I mean, I don't use Colgate, but let's just say that I love the taste of Colgate. I've always used this particular, but it doesn't say hydroxyapatite. How do I find out?
I would say it's probably fine. What I would do is take your Colgate that you love and then look it up on the RDA value. And
Okay.
you can just Google it.
Yeah.
RDA, it stands for relative dental abrasiveness.
Oh, interesting.
So that's what,
okay.
that's like how abrasive, or like what's the sandpaper grit? What's your grit level of your toothpaste?
Okay. And what's the range for the RDA?
So it could be from zero. Oil, for instance, oil and water are zero. There's no abrasiveness.
Okay. Yes.
Right?
And you say had actually suggested brushing with olive oil.
You can do that if you'd like, but you won't have the benefit of calcium and phosphate.
Oh,
you won't
okay.
be able to remineralize.
I see.
Okay.
Got it.
Now, RDA values above 200 are usually the whitening toothpaste. Mm-hmm. And those, I think most people should avoid that.
Okay. Why?
Whitening toothpaste works by basically sanding your tooth with sandpaper.
Oh, wow.
But more like polish,
Uh-huh.
right?
Uh-huh.
So instead of using
Fine
sandpaper,
sandpaper.
fine sandpaper, but it can get fairly coarse. And everyone's had well, I shouldn't say everyone, but some people have had the experience of brushing with toothpaste, whitening toothpaste especially. And all the companies have whitening toothpaste. You can find all the brands have whitening toothpaste. But the one thing that you will find, the pattern is that it's crunchy. It's really crunchy. It's unpleasant to keep that in your mouth. So that I think that we've kind of raised up a whole generation of rinsers now because they're like trying to rinse off all that crunch that they got from their
Raising
toothpaste.
rinsers. That's an alliteration for you.
Exactly.
Yeah,
Right. But I think that there's some truth there.
Yes, right. And it makes sense because everyone wants white teeth. Now, the few times that I've tried whitening my teeth with a whitening toothpaste, I get what's called, and you told me about this as well, sloughing. So I don't use whitening toothpaste because of that. So can you explain what is sloughing?
Well, I'm not sure if we've got really good research about sloughing because there's so many other factors. Some people that have tissue type, like I use the analogy of fruit. So orange skin, an orange peel is very tough, right? Pomegranate even more. But some skin is very delicate, like a peach, right? Or a strawberry, very delicate skin. And there's also it's like a bell curve. Different people have different skin types.
In their gums, in their mouths.
Yep, exactly.
Yeah. Oh.
Some have really delicate peach skin.
I see.
And
Fascinating.
some have really thick orange peel, skin.
Wow.
So if you've got a delicate skin type, you might be damaging your gums with not so much the toothbrush, although the toothbrush bristle is important. It's not quite as important as the abrasiveness of the toothpaste. Because of a study from Australia, a wonderful study showing the repetitive brushing motion on extracted teeth, teeth that have been basically mounted in a lab, and then they've got robots that are brushing day and night.
Wow.
And then they've got numerous types of brush tips, soft, firm, medium, and then they have numerous abrasiveness. And what they discovered that a toothbrush, maybe a medium or a firm bristle, not the soft, without any abrasiveness, like maybe oil or something that's very mild, like baking soda, for example, would not do any damage long term. Okay, but once you introduce the abrasiveness, like these whitening toothpaste, now you're starting to polish a little too much, and you're taking tiny little layers off over time. So this is a very important. It's an important point that if you're doing this twice a day for 20 years, you could really start to see an impact later on.
Like your teeth turn gray?
No,
like,
I would say like the chocolate
like?
layer, the abfraction.
Oh.
The edges of the abrasiveness at the
gum line.
Yep, right at the gum line. Yeah.
So you wouldn't see necessarily any change on the surface of the tooth?
Right.
It's at the gum line.
Well, I mean, enamel's very, very strong. It's like stone.
Oh, okay.
It's similar to glass. So it's not going to show the wear like you would see dramatic changes at the gum line where the edge of the enamel stops, and then you have the margin where it starts to the softer layer. We call it the chocolate layer because we're using the M&M analogy here.
Yes.
So the chocolate layer is very susceptible to those abrasive toothpastes, which whitening toothpaste is one of them.
So if you are using a whitening toothpaste and it has a high RDA level, 200 above, then you would just use a whitening toothpaste in short periods of time. Go back to a toothpaste with a low RDA that's softer on your gums, and then maybe you could do it for another, 2-3 weeks at a time.
Yeah, I mean, if you want to make your teeth have that squeaky clean, or like maybe you're going out on Friday night, you can use that whitening toothpaste to have an immediate effect, but over long term, probably not a good idea to do it over and over again.
Okay.
As your primary toothpaste.
Yes. Okay. That's gold advice for people.
I think so.
So what's the deal with fluoride? There's a lot of, we hear all kinds of things in the news. Fluoride in the water, no fluoride in the water, fluoride in the toothpaste. So what do you suggest? Yeah,
the fluoride debate is so full of misunderstandings, right? So I would say that the first misunderstanding is this concept that we can take a pill or swallow something to have any effect whatsoever downstream. Like people do this, they'll tell me that they just need to take some calcium pills to help their teeth, right? Or if you've got an ailment, you take a pill, but not understanding how the process works. So with fluoride, the teeth are formed, and there's lots of variations here, but generally speaking, the enamel is done by very young age. Oh. I would say you should think of maybe 5, 6, 7-year-olds, something like that.
You mean how much enamel we have now in our mouth at any age is basically fixed at the age of 5 or 6?
It's been formed.
Wow.
Yep.
No more enamel for you, basically.
Correct.
Okay.
Yeah. So the only impact of fluoride in the drinking water that's being swallowed would have to be ingested before that age.
I see.
So you can't drink fluoride as an adult and have any effect on your teeth whatsoever because it just doesn't get to where it needs to go.
Fluoride in the water is for children, young children.
Yep.
That's when it's important.
Correct. Yep. And there is a toxic level of fluoride. So generally speaking, 1 part per million is considered safe. Now we don't have fluoride in our drinking water. Okay? We don't add it to our drinking water. We don't control it, in that way in the city water. But some areas have dangerous levels of fluoride, in their drinking level. And some areas, for example, mountains in Colorado, like if you dig a well, you're going to get water that's high level of fluoride, okay, at a super high level. And there's research showing that children that are in high levels of fluoride have lower IQ tests with children that have 0 fluoride in their drinking water.
Oh my,
And so because of those studies, those research studies that are considered good studies, there's a fear of fluoride, just eliminate fluoride whatsoever.
Right.
Right?
Yes.
And I can see that. I can totally understand that. And so therefore, we don't have fluoride. I don't believe that drinking fluoride or swallowing fluoride is a good idea. However, fluoride does work really well topically in certain cases. It is very effective because what it does, and I'm generalizing here, but just for the sake of illustration, introducing fluoride to hydroxyapatite helps the hydroxyapatite bond to the surface. Oh. So it's like the salt in the salad.
Yes, right.
It just makes it makes it work. Makes it work. You're right?
Yeah, I get it.
Similar to lithium batteries, do not have high levels of lithium, just enough to make the whole thing work. It makes the cake work.
Yeah, right.
So that's why 0 fluoride in your toothpaste, and you don't know why you have so many cavities. See what I mean?
Yes.
Like it can work topically really well. So in some cases, it will work, but I think you should weigh that against other concerns. So I think we need to be careful on the the dose and the duration, especially with children, but also, there's other factors that I would first try and eliminate rinsing toothpaste. That
Stop rinsing.
Stop rinsing is something easy we can all do.
And use a toothpaste in general with a low RDA or low grit value.
Right.
Yeah.
Yeah, and mostly you do that because of a person's ability to keep that tooth. I mean, it's a little bit more pleasant to have low abrasiveness. Most people don't like the crunchy because it feels like sand.
It does feel like sand. Yeah, I'm remembering back to those times when I had a toothpaste like that. Yeah, it's very unpleasant.
Most people want to rinse that out.
Who likes eating sand? Nobody.
Right, exactly.
Yeah.
I mean, the first reaction to like having sand in your mouth is to rinse
it out.
that stuff out. Right?
Yeah, exactly. Now, when I come in and have my cleanings done, I always pay a little bit extra to have that fluoride treatment that you provide. That tastes great, by the way. And so tell me about that. Like, how does that help me?
Fluoride combines with calcium phosphate, hydroxyapatite to help remineralize your teeth. In your case, you're concerned about the edge, by the gum line, and that would be really good for that. It also would be good for reducing the sensitivity, cold sensitivity, and that's because of the calcification, the remineralization.
Is there a way to do that more often? Because I only get that done twice a year when I'm here. Is there a way to get that topical fluoride if I'm not a dentist and do that once a month? Or
if your fluoride level in your toothpaste is adequate and safe, I would say that you could. What's more important is the multiple exposures to toothpaste.
Okay.
So if you're concerned about cavities or sensitivity, and you can, brush on the toothpaste, rinse or spit the extra. Don't rinse. Don't swallow it, but don't eat or drink after that.
For how long?
Probably 20 minutes.
20 minutes, okay.
But if you can do 5 minutes, that's fine.
Okay, all right.
And if you can, if it can be the last thing you do before going to bed, that's great. But just try to not eat or drink for a while. And that's just similar. This is kind of like, do you remember? I don't know if it's like a lollipop TV ad. This is a long time ago. Or like, how many licks does it take to get to the bottom?
Center of a something.
Exactly. Or how long? Right. Exactly. It's probably similar to like
Tootsie Roll.
Right. Tootsie Roll. Yeah. Or is it Tootsie Roll?
Or maybe it's not Tootsie. Tootsie Pop.
Tootsie Pop. Is it Tootsie Pop? Yeah. And then I think it was an owl that was like licking on that. Right. And no one could go more than like a few licks.
Yeah, that's right. Yeah, somebody holds a Guinness World Record, I think, for that.
Right. So really?
Licking
That's
it down.
fine.
Yeah, actually know her. I know her.
Oh, really?
She was, I think, 12 when she wrote Tootsie Pop. Her name is Nancy Jutton. She lives in Bellingham. And she said, I licked all the way down to the center of a Tootsie Pop. She counted how many licks, sent it in to the president, and got this big certificate that they framed.
Wow.
Put up in her bedroom.
That's amazing.
I know.
That's incredible. I love that. I love that. That's incredible. I want to meet her.
Yes.
That's great. I'm so proud. Yeah.
Oh, so we talked about flossing, toothpick, gum health, toothpaste, toothbrushes.
Yep.
Mouthwash.
One concept I want to say before we go into mouthwash is think of your toothpaste like you think of lotion or leave-in conditioner, like say, for instance, hair conditioner, right?
Yeah.
Let's say your hair is really dry and you think you need to use conditioner for your hair, right? You would not put the conditioner on and then immediately shampoo conditioner off or rinse it off. Maybe you would leave it on.
Yeah, right. My hairdresser always does that.
Or lotion for your hand. You would not wash your hands and then put on lotion and then immediately rinse your hands.
Yes.
Right? You would leave it on.
Yes.
Toothpaste is lotion. It's not soap.
Oh, man.
It's kind of like both soap and lotion, but I think we should see it as more like lotion.
Yeah, see, there you go with the great metaphors again. That is so easy to understand, and I totally get it.
If you're concerned about if you have sensitivity, cold sensitivity, that's an easy thing to do with the toothpaste you already have. Okay, you don't have to have a special toothpaste. you can do, as long as your toothpaste has adequate hydroxyapatite, and it can remineralize your teeth just by leaving it on for 5 minutes, or not eating or drinking for like 20 minutes. And then it would be like, how long do you have to leave on the leave-in conditioner? Like as long as you can, right?
Yeah.
Just whatever is a reasonable time.
Yeah.
And mouth rinse, on the topic of mouth rinse, if you need to use mouth rinse, usually it's a contact killer. So it's going to kill bacteria. And so I would rinse before you brush.
Well, okay.
Yeah. Or you could put a little bit of mouth rinse in a water pick.
Yes.
You don't need the whole thing. You don't need to be spraying mouth rinse. Just a capful, just a little bloop into the tank. And we can talk about like types and what we like to recommend, but all you need to do is put a little bit of mouth rinse. You want to avoid some flavoring agents that can like gum up the system. And I can talk, like one good one is Closis, that without the flavoring agent, and I could talk to you about it. I could share a link for that.
Yeah, that's interesting because I've never used a water pick. And I mean, well, staying on the topic of mouth rinse first, because so number one, if you're going to use a mouth rinse, use it before you use your toothpaste, because you should not, because you need to leave your toothpaste in, because it's like lotion. Don't rinse it out of your mouth. Right. And then what about those mouth rinses with alcohol in them? Okay,
so the problem with alcohol is it will dry your tissues. It just dries your skin. And I think that's why we've avoided alcohol. However, some mouth rinses have chemicals that, that were even worse.
Yes, yeah.
Cool.
So we were talking about mouth wash and that some mouthwashes have alcohol. Actually, I think quite a few of them have alcohol in them. And then you were saying that some mouthwashes have chemicals that are even worse than alcohol on your teeth. Alcohol dries out your gums and your tissues. So what are those other chemicals that we should avoid in a mouthwash?
Okay, so alcohol, it has been used for many years because it's easy to produce. It's cheap, right? Some other things that we use that will kill bacteria. Another analogy here, because I love analogies.
Yes.
But you've got a pool or a jacuzzi, and you want to shock the pool or clean the pool, right? So we use sometimes bleach or chlorine, bromine, which I don't know any mouth rinses that have bromine. There is some chlorine that is safe and effective. The other ones could be like peroxide type in the mouth rinse.
Really?
Yeah, and really what you're trying to do is kill bacteria.
Peroxide is okay?
Well, I would not recommend rinsing with peroxide. Okay. Hydrogen peroxide at any level, I don't know. I can't speak intelligently about like what level of peroxide mouth rinse would be safe. I would definitely dilute it a lot. Because
there are toothpastes with peroxide in it.
Right. So peroxide comes in usually 5%. So some people do a lot of damage with like rinsing with like 50-50, peroxide rinses. You can get ulcers from that, or like you basically burn the tissues in your mouth, the sensitive tissues like your cheeks.
Or get the sloughing.
Right, exactly. Or your palate. And you end up with an ulcer because then it irritates the skin, and then your body has like an immune or a cellular reaction to that.
Wow.
So I don't recommend peroxide. I think we should be careful with that. But alcohol is just one way to kill bacteria, or like basically take care of the pool, or take care of the garden. You just want to kill the weeds and encourage healthy bacteria. So there's some probiotic mouth rinses that are great. But you're probably not going to move the needle very much. I would tell the probiotic mouth rinses just like, don't flatter yourself, because your bacteria has already been established. It's like the new kid in school, It's a new kid in high school, you know what I mean? And right,
doesn't have any friends yet.
Right, exactly. And all of the, you're a new kid, senior in high school, so
And you have good bacteria in your mouth and in your body.
And that's usually already established.
Yes.
I mean, it's really hard to change that. It's really hard to like really transplant a whole new bacteria.
Right.
But sometimes you can shock the pool,
Okay.
shock all the kids at school, and have and like really, it's similar to transplants in the rest of your intestines. Like they are very established, and it's really hard to change that.
Yes,
Antibiotics
the gut biome.
The gut biome, yeah. Antibiotics can really have a drastic effect on gut biome. So you have to. I mean, I think we are using those more carefully now. They're way overused. I think for like a lot of joint replacement patients. Now it's gotten really, it's gotten, I think like, man, I've heard even as small as like 3 months after surgery, which is surprising. But like for knee replacement or hip replacement, you don't have to use it for 2 years anymore.
Okay.
Amoxicillin, penicillin every time you go to the dentist.
Right.
Those are getting less and less. Now there's situations where you have like a heart valve where you might be on that for the rest of your life.
Yes.
But when you need an antibiotic, you want it to work. But the downsides for GI downsides, side effects like colitis can be dangerous with some antibiotics.
Well, I have a question about that because my husband had a knee replaced. So when he comes in and has any significant dental work, I think even a cleaning, you give him an antibiotic of some sort. And if he comes in for a major, let's say a crown or something, then he has to take antibiotics for a period of time before and after, so that the bacteria won't go to his knee and cause a systemic issue.
Yeah, and
so,
the reason we do that, is because of the theory or the concept that any kind of bleeding anywhere in the body, like, or in this case, the mouth, if you expect to have bleeding in your gums, some of the oral bacteria in the area can get upstream, can get into the blood. So now there's bacteria in your blood. Your body has a really, really great way of attacking that bacteria. But if you need a little bit of help by taking oral antibiotic, you need to have the antibiotic in your blood before you introduce that bacteria, right?
I see, yes.
Now, your husband who's taking that and thinks that he has to take that every visit for years and years and years might not need to take it anymore.
Oh, okay.
And we don't like to be the only ones making that call for patients. We would like you to check with your doctor. It's very easy to find the guidance on this.
Yes.
And it's there's going to be an academy for orthopedic surgeons that has or cardiologists that have like their own general like guidelines.
Yes.
It's very likely that patients think they need to take it for the rest of their life, and they really don't.
Well, he did have the unfortunate experience. It wasn't, after coming here, it was on a fishing trip where, and he doesn't even know how it happened, a cut or a nick. Some bacteria got into his bloodstream, and he ended up in the hospital for 3 days. They had to take that implant out, scrub it down. He had like sepsis.
So that's on his knee, right?
On his knee,
and it's just one knee?
Just one knee that he had replaced the prior year.
Okay, so a year ago, the knee... He developed sepsis on the knee from a cut, right? Yeah,
so he had the knee replacement 4 years ago now. A year and a half later, he got that little tiny cut. Bacteria got in, went right to that implant, and basically his blood tried to kill him.
Right.
So he ended up in the hospital. So that's the reason why, we're overly concerned about him coming into the dentist and having the...
So in that case, I would say... he might have to take that because he's demonstrated such a sensitivity to that.
Yes.
So I'd be comfortable just doing the antibiotic pre-treatment every time he comes in.
Okay.
But check with your doctor because some of them are saying you don't need to do this.
Right.
But in that particular case, because he's demonstrated that episode, I would say if we're seeing him for cleanings, he's getting the pre-med. antibiotic until we hear otherwise.
Okay.
Yes. And we're still doing that. We're not making the call, we can dispense it.
Yes, that's right. Mm-hmm. I didn't know that until his last visit, because I thought he had to have a prescription from his doctor, but you can dispense that.
Well, yeah, I mean, we're going to write you a prescription, and so you'll have that, and we recommend people take it an hour before they come in. But sometimes if they forget, we have it here.
Yeah, that's great.
So I would just have them let us know immediately. Let us know as soon as they find out.
Yeah, for any implant, if you've had an implant, then there's something to think about.
Yeah, I mean,
and to tell you about.
And usually after you've had an implant surgery, like a artificial joint, they're going to have that conversation with you. Every time you go to the dentist, you just need to remember this.
Yes, right.
And we're going to ask that question too. And so there is a backstop. So and we've got a stock of it here. We've got for office use. It's not a controlled substance, so we can keep some here.
Oh, I see. I see. Yeah. Well, I wanted to share my story about the 4 crowns that you redid on my bottom teeth.
Yeah, great.
That changed my life. So I had, this goes back 15 plus years.
Okay.
I chipped a tooth when I was in my 40s, one of my bottom front teeth. Went in to see my doctor. Back then I lived in Everett. And initially it was, well, we can't just replace one tooth. You need a crown. We'll replace 2. And then in the middle of this planning and discussion, they said, well, actually, we actually need to do 4. Okay, fine, let's do 4. And these 4 were the ugliest teeth. I felt, I can still remember the feeling of looking in the mirror. Not only was the color wrong, shape was wrong, and I wanted to cry because there was nothing I could do about it. And I felt like they were sticking out of my mouth, that every time I closed my front teeth over my mouth, I could feel my bottom teeth. So I kept having to go in. They would grind them. They're grinding now the polish off, right? So the color is completely inconsistent. It ended out that I was so unhappy that they said, fine, we're not going to charge you, because anybody could see by looking at my teeth. Yeah. Like when I would smile, that is what my eye would always go to. And so I was, like many of your patients, self-conscious about my smile. And that changes your life.
Yeah, it does.
When you don't want to smile, when you don't want to show your teeth, and constantly thinking about how you smile because of your teeth. When I met you and you asked me, what do you think about, I'm getting emotional now. What do you think about your teeth? And to even talk about my teeth, like to even discuss it with anyone, would just get me like I'm feeling right now. So upset, because it would take me back to that moment of looking in the mirror and realizing I've made a big mistake. I should have just left that chipped tooth alone.
Right.
And you said, when you're ready, and this is what you always say, when you come in and you explain choices to me, like I have 2 teeth in my mouth right now that at some point will need crowns. And you say, it's not urgent right now, but within the next year or 2, let's do something about these before they become a bigger problem and you need a tooth implant, and who needs an emergency visit to your dentist, right? Let's be proactive. So these teeth, you said, when you're ready, we can change this. So the day that I was ready, I came in. It was like a spa experience. That's how I described it to everyone. I came in so relaxed, and I'm one of these people who, when you get a shot of Novocaine, like it wears off really fast on me. Like people with red hair, of course my hair is white now, some of us metabolize. So that, and you kept me appropriately numb and relaxed to keep my anxiety down, which, would have been sky high had I not been here. And because my trust level was, it was when my trust level with you, which happened very quickly, was to a point where I felt like I'm in the best hands for somebody to finally fix this issue that has changed my life in the wrong way. So I'm sitting there and you're coming in and you're talking and we're having a good time. Your staff is coming in. I'm watching wonderful television programs. Would you like some water? I was so doted on. And again, it did feel like a spa. You reveal the end result of my teeth and I cried.
Yeah, I remember. Yeah.
I couldn't wait to show the world. Like, not that I'm the one that noticed mostly, right? Most people don't notice, but in every single picture I would notice. And I just couldn't wait to, like, put me in front of a camera.
Yeah. You're not holding back anymore.
Not holding it back anymore,
Right.
yeah. And that's what you see when I walk around the office and I see these beautiful pictures, before and after pictures. You're magic with people. It's
Thank you.
Extraordinary.
And thank you. I love it. Thank you. I appreciate you saying that. Yeah, and especially for someone like yourself who is a professional speaker.
Yeah. Yes.
And the lower teeth, especially when
yes.
when we smile, we're mostly upper teeth, but when we speak, guess what? Those are the lower teeth. That's when you see the lower teeth.
That's right.
So, if you want to just look in the mirror, what I tell people is, while you're looking in the mirror, say, "I don't show my lower teeth when I talk."
Impossible.
Yeah, when I talk, I don't show my lower teeth, and they're always showing their lower teeth.
Of course, yes.
It always gets a lot of laughs, because at least the top 50% of the lower teeth, very few people do not show lower teeth when they talk. Some people don't. Most people do. But so we do a little exercise sometimes, but just to have a little bit of fun. But someone that is aware of speaking and how they look on camera, like you, is going to be, that's going to be amplified, right? That's going to have a big impact on you emotionally.
How the light hits your teeth.
Yep.
It's
And the emotional
huge.
effect of that, because you know how much speaking can change, or holding back can change your speaking. And a lot of people aren't as sensitive to that as you are.
Yeah, right.
And you're teaching that every day. So
I am.
It was such a privilege to meet you. And I've always felt that way. I knew right away that we were going to get along great.
Yeah.
And we did. Yeah. We love being around you every day. And I know we've taken a lot of pictures together.
Yes.
And so I knew that I could learn a lot about speaking from you, and kind of work on some of my speaking, like weaknesses.
Yeah. Well, your confidence and your comfort level. I mean, you've hired a professional to produce this podcast, and you come across. I've watched you over the years. Your confidence and how you come across on camera has just. I mean, that's why I always say you're the dentist to the stars. That's why you're ready. You're ready for Hollywood.
Thanks.
Yeah.
Yeah, that's right. I'm going to move next week. Yeah, right now.
Yeah.
Right. Yeah. Okay. Yeah.
We're going to turn this from a podcast into a television series.
There you go.
Right.
Right. Let's do it.
Okay.
Let's do it. I'm going to sell everything. Move to LA. No. We're having a great time right now. I love the people I work with, and the patients in Skagit Valley.
Yeah.
Have been great. And
they are great.
Yeah. And so we're having such a good time. And there's always the next project.
Yeah.
But yeah, we're having a great time. And I think that I can't take all the credit. The technology has improved a lot. So in order, we're almost everyone's using 3D scanners now. So the accuracy's gone up.
Yes. Yeah. That's the amazing thing. Going back to my tooth experience, to have 4 crowns done. I come in the morning,
Right.
have the spa experience, and by 2:00 in the afternoon, I'm walking out with 4 beautiful teeth.
Right. Yep.
That's amazing to me. In the past, it would have been this 2-step grinding process, right?
Right.
You come in, you have the fake teeth for, that's how it was the first time.
Yeah.
You have this like little plate of mush that are supposed to be temporary teeth in your mouth, and you're hoping it doesn't fall out. And if it does, you have a little packet of glue just in case, because what's underneath would look horrific.
Yep.
if you or anybody saw it. But in your case, I just couldn't believe how fast it was that you can have brand new teeth in your mouth, 4 of them, inside of hours. And they're perfect. Perfect.
Yeah, there's been 3 or 4 different technologies that have improved: hardware, software, chemistry, and I think the last one would be style.
Well, the way that you invest in technology, that's the other thing that I've noticed over the years. Like, you spare no expense when it comes to cutting edge technology. What's new, what works best, what's best for the patient.
Right.
There are some dentists who maybe can't afford or decide not to, maybe hold on to their older equipment. But you're always at the cutting edge of technology.
Yeah, I mean, and that's from people I've worked with, Sun Valley, or actually when I was still in my 20s, I think, late 20s, Dr. Zeno, an Italian dentist outside of Madison, Wisconsin, Sun Prairie, Wisconsin. He was one of the first adopters in CEREC, and I worked for him, and he taught me a lot. So when I had my own office, I was ready. I was ready. So after that point, the chemistry improved. The cameras improved a little bit. The hardware, the chemistry improved.
What is the chemistry about?
Yeah, I mean, the crowns that you had, the ugly crowns that you were mentioning, were probably porcelain fused to metal.
Yes, they were.
So metal is like a thin layer at the bottom. The problem with it is it blocks light.
Yes, it did.
So it's opaque.
Yes,
light does not shine through it. And natural teeth.
That's why they looked gray.
Yep. Yep. Yeah, and especially at the gum line. Right.
Horrible.
So natural teeth actually glow, kind of like a jar, like a alabaster jar, probably similar to alabaster stone.
Oh, nice.
Teeth have similar optical characteristics as alabaster stone. So a candle behind the stone makes the stone glow.
Yes.
Teeth have that same characteristic, and if you put, a metal tooth, it's not, obviously it's going to reflect the light. And then they would stack sand, type of sand, that would become like a shade of white on top of the metal to for it to look like a tooth. Now this is technologies that's been replaced now. We don't need to use that anymore. Some of the chemistry that I'm referring to is Ivoclar has a product called Emax. It's lithium disilicate, which is a type of glass. A type, you could say it's like a replacement for the hydroxyapatite in your enamel.
Oh, wow.
Right. And it started out as a chemistry called Empress, and then Emax was Empress to the max. So Emax kind of changed the industry 25 years ago or more. And when Emax came out, that really changed the strength. So you could get something fairly strong, 400 or 500 kilopascals of edge strength. So that is how an edge is measured. Gold, obviously, it will bend, but porcelain will break. Enamel has about 200. Emax has about 400 or 500.
Oh,
zirconia has like
stronger than
800 or 900
teeth.
Yeah, stronger than teeth, stronger than the edge. I mean, whatever would break your teeth might break Emax, but it's not. It's certainly a little bit stronger and tougher than teeth. Okay. But it has to have a certain thickness, about the thickness of your enamel, and it's bonded to the surface. But that really changed, and what I learned from Dr. Zeno, I carried to my own practice, and then and from there we just improved on that. The chemistry keeps improving. Other companies have different types of lithium disilicate. They have their own. It's produced in a lab where it's and it's cooked. So through the process, kind of starts by looking clear or amber colored, like an amber, like an IPA beer.
Yeah.
And it looks a lot like that when it's like half cooked. But as it goes further down the process, it becomes kind of like a cloudy purple. And then it ends up tooth colored, which is like a cloudy white. And that cloudy white shade matches, the shade we're going for in your case.
Right.
And then, and it's pretty strong stuff,
Yes.
and there's margin parameters that we're dealing with. Are we going to polish it? Are we going to glaze it? And so that kind of is taken into effect, especially at the margin and the contacts, like between your teeth where you floss.
Yes, yes.
Sometimes I'm polishing, sometimes I'm characterizing with glaze
Yeah.
to get that effect. And then the last part of the factors is the style.
Mm-hmm.
So, there's going to be different levels of talent when it comes to the dentist on like
Yes.
how to shape teeth, like what are we looking for?
Mm-hmm.
The embrasures, which is like the little triangle on the edges, sometimes they're really a straight line and sometimes there's more bumps
Yes.
between the teeth.
Right.
So generally we want the embrasures to be more closed as we're closer to the midline.
Mm-hmm.
And as we go to the outside, the embrasures slowly open up. And that's what people don't know it, but they're like, yeah, that's great. I like that.
Yes. Yeah.
And so,
And what looks natural versus what looks fake.
Yeah, I mean, if you have all your embrasures closed or like there's no differences, that's going to look like denture teeth, right?
Yes,
that's going to look
denture
like
teeth.
You're going to look like, hey, those aren't real.
Yes.
Some people want that,
Really?
and a lot of times I'll do a test drive, like a mock-up,
Yeah.
just to kind of like bring out those preferences for people, If they're saying something that I'm not sure they really want it.
Yes, right. Wow.
And we'll do a mock-up and say, here you go, what do you think? And then we can easily make changes and then scan that prototype, do a 3D scan that can be
I remember
basically,
that part.
Delivered to the lab or like used for a prototype or like a template, They even have now where you can, a mother who needs a makeover because of dentistry or for some reason that needs a smile donor. And this is astonishing and wonderful. And she will actually get a 3D scan of the daughter donated to the mother. So all you have to do is scan the daughter who has like the different, because this mother has like a unique shape, like the unique shape of her teeth.
Okay.
That has been lost.
Oh, I see. Okay. Oh, like she's lost her teeth.
In some cases, she's through excessive wear or bad dentistry, she has lost that. So she doesn't remember how she used to look when she was 18.
Yeah, right. Okay, I get it.
In her 20s, right?
Yeah, right.
So you're going through different designs. There's a lot of different designs, and it's like, that's not me. That for some reason, that's not me. But she's got a daughter that might be like in her 20s. That's it, right? So scan the daughter's teeth. That's a 3D template that can be used for the mom. And it's wonderful. It's beautiful.
That's
so in some cases, you can
incredible.
get lucky there,
Well, the other thing you're really good at is color. I mean, not just the shape and the artistry and all of that, and part of that is the color.
Mm-hmm.
I remember in like going through, deciding which shade, right?
Mm-hmm.
And you have just an eye for it, this artist eye.
Mm-hmm.
But what I've always noticed about you too, and the way you are with your staff, is you always ask them for their opinion.
Yeah.
And you value their opinion.
Yeah. Mm-hmm.
And empower them.
Mm-hmm.
Also, I've seen some of your staff just in a very short period of time go from sort of learning mode to doing mode,
mm-hmm.
and doing things that are things that dentists used to do.
Mm-hmm. Yep.
Where you're uplifting
mm-hmm.
Your team
mm-hmm.
to do the best work for everybody.
Right. Yeah. I mean, Giselle, for example, I
Yes,
trust
Giselle.
her eyes.
Mm-hmm. Mm-hmm.
Gracie has great eyes. She can look from across the room and she'll know the shade. So that's why I'm always asking, because I want to hear their opinion.
Yeah.
And
I love that.
because I don't always make the right call.
Mm-hmm. Mm-hmm.
It's something that can be changed. We always do a try-in.
Yeah.
Giselle, does great with that. Kylie's also excellent. I trust her. Rachel also has an eye for it, and Montana, she's wonderful to work with. I think, is that your hygienist, Montana?
I've had different hygienists along,
great.
and they've all been wonderful. Like I know each one of those people that you've mentioned.
Okay, I thought it was Montana. Maybe it's Rachel.
Wonderful staff. I think the last time it was Rachel. So what do you do going back to those old crowns that we used to get? Because I have 2 of those in my mouth now with more recession becoming longer in the tooth because of age. And you said, genetics might have a little bit to do with it as well in my case. But so I'm starting to see on these back crowns that metal that you talked about on the inside of the old crowns.
Right.
And it looks bad. So what can somebody like myself do about that? Can you replace an old crown with a new one? And what is the process for that?
An old crown can be separated easily, replaced. You can do a veneer on the crown if that's all you don't like. Everything else is nice.
Oh, you can? You can put a veneer on a crown.
Yeah, of course.
How does that work?
Yeah. It might not have the same strength as a veneer on enamel.
Okay.
But if you need to, if the factors of taking that crown off, for example, sometimes someone has an implant on a front tooth that has like an unusual implant type. That's a complicated connection. It's way below the gum line. It would be easier than replacing that implant, just putting a veneer over the porcelain. So you can bond to porcelain or zirconia if you need to.
And that's just a really thin layer that you bond on top of the tooth.
Yeah, you would need to use air abrasion, and you would need to prepare the surface.
Yes.
As best you can. But then it would be better to just put a veneer on the porcelain than to replace the whole implant.
For sure, and more cost effective.
Definitely.
Too, right?
Yeah.
How long do veneers last?
Those factors are multiple, different, but I like to say 15 years, 15 to 20. Composite veneers are direct veneers. Porcelain veneers are kind of like stone or tile or glass. Those are going to keep their color longer. And so they're going to last
different
a little
grades
bit longer.
And then different price points for different grades. Is that how it works?
Yeah, people replace their veneers for a few reasons. Usually it's that gum line reason because their gums are slowly receding. So they're going to replace their veneers if their gums are showing the old color, basically, right?
Yeah, right. Yeah, I get it.
Because all we can do is slow down aging, right? So
as
we can't
best
reverse
we
it.
can.
Yeah, right. So if we can slow it down, that's wonderful. Like that's what we're going for, right?
Right, that's what we're going for.
Yeah. But people replace veneers usually because of the natural aging process. It's not always because of chips and fractures, although that can happen. But usually it's because of uncovering the margin, the edge.
Okay.
And then people want to change the color. And usually people aren't as bold enough at the beginning. I wouldn't go super bright white without translucency.
Right.
So there's 2 factors in the color. There's the shade, how white is it? Also the translucency, how does it transmit light? So if it's too translucent, if it's too far on the translucency, it starts to kind of look a little bit gray.
That's how my other teeth were. Plus they had that gray underneath or that color underneath, so they... translucent teeth kind of appear gray over time. As we go to opacity, teeth that are too opaque, now you're talking about teeth that kind of look fake. Bright too
white.
Yeah.
Yeah, and some people want other people to know that they've got, veneers.
Oh.
Right?
Really?
If you want that Hollywood schnazzy, I can afford these teeth kind of thing, like jewelry.
I've seen those.
But I would say that most of my patients want to try to pull it off.
As natural, like these are my teeth.
Exactly.
That's how I feel, yeah.
Like they want to keep people guessing. Okay, they're like, ooh, those are nice, natural.
Yes, right. You were fortunate as a kid to have a great dentist and orthodontist. Look like wow.
Yeah.
Lucky
And so
you.
that's usually what we're going for.
Yeah.
And sometimes they want that. They don't know it. Maybe they've had old crowns that are too white. They're not used to the translucency until they see it.
What about a tooth? Like I have one of the teeth in my mouth that you pointed out that's going to need a crown at some point in the near future. I don't like the shape of this tooth right now in my mouth. So when I get this replaced, is there a way? Like it seems smaller than the rest, and it has like a weird angle to it. Is there a way for you to make it look better when you replace it with a crown?
Yeah, I'm really excited about artificial intelligence in dentistry, right? So the AI now in the crown design process is astonishing.
Really? Yes?
Yeah,
Tell me more.
It's pretty cool. So if we were to replace a crown, the catalog of teeth, the intelligence in the software is going to analyze all the wear patterns of your other teeth, anything in the field of view.
Wow.
Also, it's going to go into like certain catalogs of teeth, and within 15 to 20 seconds, it'll come up with a design that's pretty close. That design can be changed, and lately what I've been doing is I've been making changes, that I think are better.
Yes.
And then after seating the crown, adjusting the adjustments that I do based on the bite or whatever, guess what? I'm adjusting what I changed. Does that make sense? So
Yes.
like I'm realizing now that I'm the limiting factor. That I need to just leave it alone or make very few changes, big changes. Make very few big changes. Like I'll adjust the contact area for like floss that's really smooth and tight. Like people have that satisfying like click when they floss. They snap the floss.
Yes, right.
So
yes.
So I've got my own preferences with that, and so I don't want to take people away from what they're used to. But as far as like the AI that goes now into the crown design or the veneer design, it's pretty good, and it's going to get better. But it's already really impressive. So there's going to be factors. We're probably not going to try to take your new crown back very far from your old one.
Yeah.
But there might be some design changes. Usually what I'm seeing is old crowns that people have are too big. That's usually like more often
they
they're too
are
big.
Yeah. Yeah. I think because of the way they were built with the different layers of things.
The old way, it requires thickness.
Yeah. I mean, I can feel it. Like if I put my fingers inside my mouth and feel those old crowns, they're much wider than the crowns right next to them that you created.
Exactly.
Yeah.
So usually, the correct size is smaller than that old crowns, a little bit smaller,
and that
a noticeable effect.
And that might have something also to do with, I mean, I can just imagine a tooth in your mouth that's bigger than it's meant to be.
Yep.
Can affect a lot of things negatively.
Right. Yeah, you bet. I mean, for one thing, it traps, like food between the teeth, right?
Drives
if it's too big.
Crazy.
Right? Yeah.
Drives me crazy. I can't eat a spinach salad in public, and I have to go to the bathroom, spit out the water, and, until all the stuff quits falling out of my mouth. And then I'm safe. I've looked, maybe floss a little bit. But you're right. That's where it traps. That's why I need to get those crowns redone. That's one of the reasons why.
The contour,
it can't be good for the gums.
The contour of your crowns or your teeth is extremely important. Extremely important. And so, this is something that there's a big difference in talent when it comes to labs that aren't as careful about that contour and the way the crown's designed too. As the tooth's shaped and it emerges from the gum tissue, it has to follow a certain contour.
Yeah.
Or there are some side effects to bad contour, like a
flossing.
Shelf. Yeah, like a shelf.
Like it creates a shelf where everything sits on top of it.
Yeah.
It's ridiculous.
It's ridiculous.
So can we talk a little bit about insurance?
Yeah, sure.
Since insurance, I mean, I remember back when dental insurance was quite generous and inexpensive. I mean, I used to sell it back right out of college. I was an insurance agent for 7 years.
Right.
And for $30 a month, you could have a benefit of thousands of dollars a year in coverage, at least $2,000 for a crown. Now it's like $1,000 and you're lucky.
Yep.
And then maybe 2 preventive visits.
Sure.
But now, of course, it costs much more than $35 a month. So as the benefits are becoming less generous or people, close to my age or older than me, let's say on Medicare, and maybe they, maybe they don't have dental coverage at all.
Right.
What options, like what should we be budgeting? As we get older, most of us seem to need more dental care, not less.
Yep.
What's a budget, and then what are some ways to think about maybe insurance? Like I know you offer an insurance plan that we intend to go on in the very near future.
Yeah, I mean, the dental insurance industry is, I guess, relatively new, maybe 30 years. It's not, it's probably 2 generations old.
Yeah. Wow, that's right.
And I think that, like, I'm going to give the analogy of like airline tickets, right? They've also become really competitive now. I mean, airline tickets haven't really changed, even though the inflation's changed a lot.
Yeah.
Airline tickets are about the same price as they were, a couple of generations ago, right?
Right.
I mean, when I was a kid, we were lucky to take like 1 trip a year.
Exactly.
And that was a big deal, right? That was, it was a big expense. So when dental insurance first came out, I think that the maximum benefit per year was $1,000 or $1,500. This is before I was a dentist, so it was generous, yeah. Comparative, like to what the cost of a crown might be, like $300, right?
Wow.
For example, maybe a filling was like less than $100.
Right.
And even though procedures have changed, budgets have changed,
technology
payrolls changed, technology has changed. Like, but the price of, the annual maximum stayed about the same, right? So, and why is that? Well, I mean, it's probably market competition. Dental insurance has become just a marketing plan. Yeah, it's just, that's it. It's a coupon that goes in between you and your dentist.
A coupon, yeah, that's a good way to put it.
It's similar to kind of like, like you could sell a coupon book.
Yes.
Right? For restaurants in the area, or like car wash. Or let's say a restaurant, like a restaurant coupon book. This is somebody's, they've got a magazine that they want to sell, and they got all the different restaurants and coupons for the restaurants. So they're gonna go to the restaurants and say, "Do you want to participate?" And then they're gonna sell the coupon book to the general public, and it's gonna have coupons for different things. And like one restaurant might want to have like free steaks on Thursdays.
Yes, right, yeah.
Right. But unfortunately, like that steak is only like before 6 o'clock,
Yeah.
And so now it's 6:30. Sorry, but you're at the restaurant, right? You might as well eat.
Yeah.
So you can't use the coupon, right?
Uh-huh.
And so these restaurants feel like they have to buy or participate, give away the free steaks or whatever they are, appetizers or whatever. They feel like they need to do this to get clients, right?
Yes, yeah.
Or maybe they're like a new restaurant. And the customers, they feel like, hey, I'm not going out to eat without a coupon book. Of course not. That would be like, who would want to do that, right? Because it's so expensive to eat out.
Yes, right.
Right.
Yeah.
So the general public in this community feels like they have to have their coupon book that costs $700 a year, but you get $1,500 worth of savings.
If you use all the coupons.
If you use coupons.
Yes, right. Which means you're going out a lot and spending a lot.
Exactly.
Yes.
You're going out a lot, spending a lot. You maybe have unnecessary procedures.
Yes.
You're buying things that you wouldn't ordinarily do just to utilize it.
Correct.
And then also the feeling like, hey, gosh, it's time for a new coupon book. And I don't think I got I don't even really think we used it, did we? Did we use it?
It's
we
still
didn't.
in the drawer.
Yeah, it's still in the drawer. We didn't even use it.
Exactly.
And we paid $700 last year, and we didn't even use it. But that money's gone. Meanwhile, the guy that's running this coupon system,
Making bank.
yeah, exactly,
Yeah.
cha-ching. And that, unfortunately, that happens in America way too much. I mean, I don't know if you've seen the salaries of the CEOs, but insurance CEOs are under scrutiny right now. And in dentistry, if you find a provider that you trust that has reasonable fees, might have like a system to save you, directly.
Yes. Yeah.
So the concept, like defining the term insurance might not be the appropriate term.
Yeah.
Right? But people are just trying to have reasonable fees, kind of like concierge medicine.
Yes.
Right?
Yeah.
Medical doctors that they have enough clients that trust them, so they don't participate in the big, the big health system.
Yes.
Right?
Yes.
So yeah, I mean,
It's almost like prepaying something for something that absolutely you will use. That's
right.
essential to your health, like
Right.
having your teeth looked at and cleaned twice a year.
Right, exactly.
It's essential. Yeah. So the insurance program that you offer, can you share about that?
Yeah, I mean, it's basically just a 2-for-1 deal on cleanings and checkups, and when I do comprehensive dentistry, for example, you want to have crowns replaced. I don't mind sharing that with you because I want to see my dentistry last for many years. So I want to make sure I get to see you for a follow-up. So a lot of times we'll include, like cleanings and checkups for at least a year, and make sure that my dentistry, lasts a long time.
Oh, wow. That's great. Added value.
Added value. Yep. And so that's it. That's all. I mean, when I realized that a dentist can only see 1,800 people a year as active patients.
Is that right? Really?
Well,
one dentist?
there's different ways of defining it.
Okay.
So if I see more, defining active patients,
Okay.
that's, I mean, the strictest definition of an active patient would be like, how many people have an appointment right now? Does that make sense?
Yes.
Like if you just
how
take a
full
snapshot.
is your schedule every day?
And so, like some dental offices that accept like every single insurance plan under the sun, you know what I mean? Even the bad ones. They are maybe booked out for a long time, but they're so busy that they start to demonstrate behaviors that are like, how do I say this? Dismissive behaviors. Unknowingly. These are nice. These are nice guys.
Such as
like you never see the person, or you're really short. Hey, Rebecca, nice to see you.
Yes.
I gotta go. Okay, Dr. Perry, he's always in a hurry.
Yes. Yeah. Something that you when I come in, I know that I get to have a conversation with you.
Exactly.
Yeah.
Yeah. So when you're,
I get that. I get that. And going back to how much money can you really make when you are dealing with all of these insurance companies, all of their rules, all of their rejections for things that, I mean, I've had that situation like, well, you didn't get pre-approval. I know, but you would have approved it, right? Well, we're not going to approve it because you didn't ask first.
Yep.
And then a year later, they finally cave after appealing and appealing it.
Yeah.
It's insane.
They're just following the contract.
Right, following the contract.
Yeah, and unfortunately, the dark side, the dark meetings, there are bonuses and there are systems where they encourage those kind of deny claims.
I'm absolutely sure of it.
Oh yeah, and they're going to bonus their people and they're going to limit utilization.
Yeah,
that's the bad word.
Limit utilization. That's right.
So they don't want you to know about what your benefits are. For example, they're not going to tell you or encourage you to go get your cleanings and checkups. Even though it's provided. But we've just raised this whole culture because we've got marble buildings and huge marketing budgets.
Yeah, that's right.
And big stadiums with insurance industries names and people, and they say, we're interested in your health. We're looking out for you. You know what I mean?
Mm-hmm.
We're looking out for, oh yeah, you have to, we're the providers of health here. And we have all these, providers that we provide you. So I think people are just confused. I think in the United States, they're not as confused in other countries. I don't think they're as confused in Canada for sure, about it.
And you as a dentist running a business, if you are told, we'll cover this, but you have to discount what you would normally charge in order for us to provide insurance for your patient. So now, after investing in the best chemistry, the best technology, the best people, that you would have to take a discount? Does that make any sense? And then have to fight with them when they reject a claim, and from a patient or a customer point of view, just thinking back to that last time I had to do this, I'm thinking it takes somebody with a healthy degree of self-efficacy, communication skills, persistence, to not give up. Because that's the easy thing to do after they say no, no, no 3-4 times, and then partnering with your staff who has to keep rewriting things, resending things. Oh, sorry, we didn't receive it. Well, we faxed it 3 times. Well, we didn't receive it. And that persistence of doing things over and over again, all of those hours, I think of all of the extra hours that you have to pay someone to do that. And I can totally understand when a practice says, you know what, we're not going to take that insurance anymore, nor are we going to take that insurance anymore. We do offer this, and you can pay cash, and we do take credit cards, but we're not going to deal with that anymore.
Yeah, I mean, some offices, their whole business model is that we have $0 cleanings, and then the fine print is like, if you have insurance.
If you have insurance.
Right, because, does that make sense? They're catering to the insurance people's concept of dental insurance. But, those practices are going to have struggles. They're going to have multiple full-time employees that are, fighting the insurance.
And one-time customers, too.
One-time customers, exactly.
Because somebody comes in thinking this is free, and then they find out, oh, you actually have to pay because you don't have insurance. You're like, well, why would I ever come back here?
Right. So they end up watering down the soup a lot with different providers that don't really care, that you see a different person each time. You have patients that show up, they're there because it's the cheapest. And just because, this is the place that accepts
I'm going to come here one time for my coupon. I'm going to use my coupon today here.
Yep, exactly. It's the fast food model.
It is. It's a fast food model, yeah. And speaking of fast food, when you first came in today, and today is a Friday.
Yeah.
And can you share what you do on Fridays with your son?
Yeah, I've got a 9-year-old Luke, and one of the things, my favorite part of the week is taking him to breakfast. I've got a dear friend, dentist in Georgia named Sid Parker, and he said the best thing about his fatherhood, it was having breakfast with his kids before school 1 day a week. So that meant a lot to me. I started doing that. And, last night Luke said to me, he's like, I want to go to Taco Bell.
Taco Bell.
And they've got a pretty good breakfast.
Yeah, I'm sure it's very healthy.
They just remodeled the dining room. Yeah. So anyway, we went to Taco Bell.
No, it is good. They have really great refried beans. Yeah. But we talked about drinks because I don't know, did you jokingly say Mountain Dew? Was that a joke?
Yeah, I may have had split a Mountain Dew with him. Okay. Even though, I'm embarrassed to say it. I don't think that if you don't do it every day,
right.
You're fine.
Yeah.
And so we had that for breakfast. And so he's going to school like
hopped up.
Yeah, it's
hopped
the sugar-free
up on Mountain Dew,
right? I think it was the Baja Blast. Yeah.
Okay, so I wanted to ask you about soft drinks.
Yeah, you bet.
And like a Mountain Dew, for example, because
Mm-hmm.
do they have Diet Mountain Dew? I don't drink
They
Mountain
do,
Dew. Okay, so let's say somebody got the regular Mountain Dew that's full of sugar,
Yeah.
full of caffeine,
Right.
How does that affect the teeth? And what should you do after you drink a Mountain Dew? Oh, that rhymed. I'm so glad.
Yeah, I mean, I jokingly say to patients, you can drink your 2 liter of Coca-Cola, you might become a diabetic fast. But if you rinse it off your teeth, it won't hurt your teeth.
Okay.
Right,
So
so
just a little swig of water afterward?
Yeah, I mean, it's the exposure to acid
Okay.
or the exposure to sugar, and it's the multiple exposures. So if you're just like sipping on the Mountain Dew all day, that can really have an effect. Mountain Dew is particularly damaging because of citric acid.
Oh, wow. So if you're a sipper all day, then...
Yeah, so it has a particularly bad effect, and it's a like acids are measured on pH, basically the hydrogen ion, and so some acids are really damaging. Stomach acid is the worst. That can be 1,000 times stronger, and so soft drinks, just don't watch out for the soft drinks because of the acidity. So the acidity of soft drinks is the diet soft drinks. They can still be acidic.
Oh, okay. So even diet drinks. are
Yeah,
bad
even
for your teeth.
sugar-free drinks can be acidic. They probably have a pH of about 5.
Okay.
Coffee is also acidic too.
So after you drink your morning coffee, brush your teeth or at least rinse out your mouth.
I would just say,
How about wine?
Have a little bit of water.
Same thing with wine. Yeah. Okay.
Yep. Wine, rinse with water.
Okay.
Is the easy thing to do.
Yeah. Super easy.
Swish and swallow, swish and spit.
Yes.
You don't have to swish and spit. I mean, and people aren't going to do that.
Yeah.
I would never ask someone to do that, or just like take a drink of water and rinse.
Rinse your
what I
mouth
mean?
out.
Like chase your wine with water.
Yeah.
Drink a little bit of water after you drink wine. It'd probably be the best thing to do.
Okay.
If you don't have time to brush. But yeah, that it's those exposures that build up over time.
It can make your teeth more sensitive because you have then more recession.
You can notice cold sensitivity just because of a habit that persists over time, like sugar or acid.
Oh. That can lead to cold sensitivity?
It can lead to cold sensitivity, yep. Or you can have whitening, like white strips or, excessive tooth whitening.
Same thing with the acid, basically?
Not acid, but that's when people should stop when they feel that cold sensitivity.
I see.
And that's when people usually do stop whitening because they feel that cold sensitivity.
And will that repair itself? If you get to the point where you have cold sensitivity, can your teeth recover? Oh, it is reversible.
Yeah, it's reversible.
Okay.
I think your teeth just need minerals.
Right.
At that point, they're
Start doing the workout.
Exactly. They're just starving for the hydroxyapatite.
Okay.
This surface layer has been removed, and so they're looking for some calcium and phosphate. Right.
Okay. So the last time that I was in, we were talking about insurance, and I know that you made a change in the insurance companies that you were willing to be a preferred provider on. And so you were on my preferred provider list, and you're no longer a preferred provider under my plan. But of course, I'm still here because I adore you and I trust you. And there's nothing that can replace, in my mind, that trust.
Right.
Like I'm not willing to go to another dentist.
Right.
So can you explain why you made that choice?
You bet. I felt there was a fork in the road, and I felt because of the external pressure from insurance that I needed to make a choice. I knew there was going to be consequences to that. I'm going to lose many patients. I did lose probably 1,000 patients. And I heard from some other dentists that I trust and respect that made the same choice.
It's a bold choice. Yeah.
And they said, you'll still have a practice.
Yeah.
And there's a preferred network and then like a non-preferred provider, and you're gonna pay more. I would say like 1/3 of the patients are like you. They're gonna, because of our relationship, they're gonna find another way. 1/3 is they're gonna leave immediately, and then the other third are going to leave, and then they can't find the quality of care somewhere else, and so we see them again within a year or two.
Yeah.
And those patients keep coming back.
Yes.
And every once in a while we'll have conversations about that as well. So because of the challenges I think that insurance poses for dental practice, and the fees and the reimbursement levels, the difficulty with claims, some dentists choose to be out of network.
Yeah. I get it. I totally get it.
Yeah. And so it's going to,
from a business perspective, it makes all the sense in the world.
Yeah. And you're going to find out who your friends are.
Yeah, that's right.
And you're going to be tested. I don't know. I'm not sure it's for everyone,
Yeah. Yes.
So it might not be for everyone. But it's going to be a combination of your relationship with patients, your talent level, the service mix of procedures that you provide.
Yeah.
That is all going to be, factor in. Some dentists are not going to have the guts to do it.
And even with fewer patients, what have you noticed as a entrepreneur, as a business owner?
What have I noticed after?
Yeah. Like, how has it changed your business? So you lost some of your patients, but how has that benefited or not your business?
I mean, I think I can have more conversations with patients. I think I have like a little bit more time. Yeah, I've gotten just a few minutes here and there.
Yeah. With
people like you that I enjoy, so if you love what you do, you're a dentist that loves loves the relationships.
Yeah.
Then that's the great choice for you.
And you're still able to meet your business goals, your revenue goals, those sorts of things, and have more time with people at the same time.
Yeah, I mean, I remember the analogy about like a coupon book, you know what I mean?
Yeah.
Where you're a restaurant, you just need to get those customers in the door.
Yeah,
Some dentists are just starting out, they're waiting for the phone to ring.
Yes.
They don't have any customers. Maybe the corporate office, this is like the Great Clips dentist office, right? That you see one on every corner.
Yes.
Or like a fast food. And they just need the customers. They need volume. They're obviously going to accept everything they can. It's just a marketing decision.
Yes, that's right.
Right.
Like anybody starting out in business, you do what you can to make a name for yourself, to establish yourself in someone's life, basically. Yeah.
Yeah, but when you reach a certain level, then you're free. You've kind of reached that critical velocity.
Yeah, congratulations, by the way. I mean, that speaks volumes that you were willing to do that and see benefit from it. And I've seen benefit from it too, because I've noticed that you are able to spend a little bit more time, which I value and cherish, our conversations when I come in. I introduced you to Dr. Yoram Solomon, who's written a book and has a program called Trust Premium. Trust Premium is the name of his book and his keynote, and he travels all over the United States, all over the world.
It's a great book.
Talking about trust in a business relationship. And what he's done through all of his research, what Trust Premium means is that if I trust you as I'm your customer, you're my provider, I trust you, I am willing to pay 40% more, that's the premium, to keep you in my life.
Yep.
And so we see it playing out here, and you see it playing out with those customers like me who said, I'm not going anywhere. I don't care that my insurance company is not paying that extra coupon value for my cleaning visit. Right?
Exactly.
Because this mouth of ours is precious and important for the duration.
Yeah, and you said it. That's I love that definition of the trust premium. It encapsulates so much in how we behave. I mean, these are all worldwide values on consumer values.
Yes.
Right.
Yeah.
These are consumer values.
Right.
And it's a great way of defining that. So it's a great business book related to trust. I mean, I think that people trust Starbucks for how it's going to taste.
Yes, exactly.
So
Brand
they'll pay more
loyalists.
for that. Yeah, I know.
I know I am.
Yeah, they'll trust. They don't want to be surprised.
Mm-hmm. Mm-hmm.
Right?
Consistency.
They want to know what that's going to be like, that experience is going to be like. So they'll spend a little bit more for that. I'm sure that's in line with that.
Completely.
Right? Mm-hmm. So, yeah, but I love that book. I'm looking forward to spending some time with him.
Yes, right. I think he's going to have you as a guest on his podcast.
Yeah, that's what we're talking about. We need to get together. I think we got a meeting coming up pretty soon.
Oh, that's great.
Yeah.
That's great. Wonderful. Well, earlier we were talking about the routine of taking care of this precious mouth of ours. Mm-hmm. But we talked about flossing and the pick, the plastic pick that you can use for 6 months. Do not throw it away. Do not hurt the turtles, basically, right?
Right.
Do not poke the turtles in the eye.
You save the ocean.
Save the
turtles.
Ocean.
Save the whales, right?
But the floss that I use is still the pull-through kind.
Yeah, that's great.
And there are so many different kinds of floss, though. The really, really skinny kind, the wax, cloth, the stuff that's supposed to biodegrade that breaks in the middle of your teeth.
Yeah.
I've tried everything.
Right.
And on your recommendation, I have a floss that I use. Can I say the brand? Is that all right?
Yeah, go ahead.
Cocoa Floss.
Yeah, Cocoa Floss is a great one.
That's what I was recommended.
Yeah.
So how does one, and I need it because of all of these nooks and crannies in my teeth that we've talked about because of my old crowns, to really get in there and help me get things out.
Yeah.
So how does one go about finding the right kind of floss? Like, do you have any tips on choosing the best floss?
Yeah. It always comes back to utilization. So if someone doesn't like their floss, they're not going to floss. What good is it, right?
Right.
So it would be, let's use the analogy of like exercise. You need to exercise. Some people like to run. Some people like to use the rower or the Stairmaster or the treadmill. But whatever gets their heart rate up and, and then gets them physically into it is what you should choose. And so floss, some people it's very satisfying to feel that woven floss, then that just feels like, it's like wiping a sweater between your teeth.
Yes, right.
I mean, some people like that. I mean, I've heard hygienists say that that's what they want, and so funny. They don't want to give that up, and I would never want to take that from them. That's great. The opposite side of the spectrum is the glide floss, right? Yes. Or Teflon, which nothing sticks to Teflon, right? It's so slippery that you hardly feel like you're doing anything.
Exactly.
So you're like, gosh, I mean, it's easy to floss, but am I really doing anything, right? So that would be the other side of the spectrum, right? If you're using floss on a string, then that takes a little bit more skill. You're putting your fingers in your mouth.
Yeah.
And some people don't like to do that. But there are some advantages, like a shoe shine technique. So it's going to wrap around your tooth a little bit better.
I see. Okay.
Then those flossers, don't really do that as much. But you can like articulate the flossers, to do that. If you just take a few seconds to, you can overcome that effect and get the same effect. So I would say you don't want something that's got no texture, and you don't want something that has too much texture because maybe it's difficult to floss for people. Yes. Somewhere in between, there's probably a Goldilocks.
Or too skinny.
Just, too much, too little.
Yeah, right, Goldilocks. Right, yeah, find your Goldilocks floss.
Yeah, exactly. And that's going to be different for each person.
That could be a new brand name for floss. Goldilocks floss.
I know. Goldilocks everything.
Goldilocks everything. Goldilocks life, right? Yeah.
Put Goldilocks on like I'm into like chili oil now. I don't know if you've
Mountain Dew.
Yeah. Yeah, right.
Yeah, chili
it's just
oil.
Like, right. Just
get the right heat.
Yeah, exactly. Just not too hot, not too cold, just right.
Yeah, just right. So when you are flossing, do you want to take the floss all the way down as far as it will go around your tooth and then pull it through or saw back and forth? What's the best?
I mean, if you're not confident, then I would pull it through.
Okay.
If you've got, complicated bridge work, you might want to pull it through. Or an implant.
I notice that's what you do in my mouth, or when I come in for a cleaning, they pull it all the way.
Yeah, I mean,
through.
when we're seating veneers, like we will, and we're flossing for the first time, I'd use the pull through because I don't want to have pressure, coming off. Maybe the cement. I'm just still, it's still hardening.
Right.
Right. And
that'd be bad.
Or curing. So that's where we use the pull through kind of method. But as far as like, every day, I mean, go ahead and go back and forth is preferable. It's great. The flossers that I like are plackers. 3M makes a good one. I think Scope and Oral-B have a fiber that's pretty good.
Yeah, Oral-B I think is what we have.
If you have like a generic brand, the problem with it is not going to be in the plastic. The problem is that the fiber is going to shred quick. And so that's I would say choose the high quality one for the environment because you can reuse it. You can sanitize it like you would a toothbrush and continue to use it, right? And don't throw it away until it shreds, and it would last a lot longer. And it's going to really cut down on our consumption of those flossers and all the plastic that's produced.
Yeah.
So that's my message for my environmental message is to reuse your flosser. And that might sound gross to some people, but I think that like it would be better for the environment if we could like reuse that thing.
Yeah. Could you like keep it in a little thing with water and hydrogen peroxide, like just dip it in there to sanitize it?
Yeah, exactly. That's what I'm going to do. I'm going to like introduce like one of these little ultrasonic.
Cute yeah.
Just called it like a Goldilocks bath or something like that.
Yeah,
right?
Goldilocks bath. Yeah.
Let's do it.
And then put your branding on it. Put your face on it. With your big smile.
Yeah, I'll go to you for some help with my commercial.
Okay, everybody needs one of these in their bathroom.
Yeah.
Or in my husband's case, he does his flossing after he eats dinner in his Lazy Boy.
Yeah, I bet, something even better than that, probably that would, instead of chemical, it would be UV.
Yeah, UV. That's a great idea.
Yeah, you could just like have two like LCD screens or, lights.
Yes.
Just click it closed.
Well, you know what else you could use that for is a mouth guard, which is the next thing I wanted to talk to you about because you made an adjustment to mine. I've had a mouth guard the same mouth guard for quite some time.
Yeah.
And I was wondering if maybe it was causing my recession because I have had it for a long time. You explained that is not the reason for my recession. I was hoping for a quick fix, like get rid of the mouth guard and you'll be fine, or you just need a new mouth guard.
Yeah.
But you did make an adjustment to it. How do you know when you're a person who needs a mouth guard? What does that having a mouth guard do for you? And why should you consider one?
Okay, yeah, that's a great question. So a night guard for night wear, there's also a day guard, mouth guard.
Oh, there is.
Yeah, I mean, some people want to turn off the clenching or the grinding while they're, at work or something like that. And for those, we usually go with a lower one. For a night guard, we usually it's going to be an upper, although it depends. Some people have preferences. But
does it look the same, the lower and the upper, like it covers your teeth? So you wear it during the day and you have this plastic thing over your
Usually
teeth?
the lower is a little smaller. Doesn't need to be very big.
Okay.
The upper, and my favorite night guard for the upper, I remove the second molar, so it only goes to the first molar. And then I remove all the front teeth, the front four.
Yeah, that's the front teeth of the night guard. Not your front teeth.
Yeah, I don't remove the. Yeah.
Take your molars and your front teeth out, and you're going to be good to go.
No, we keep your front teeth. Sorry. Yeah.
So how do you take how do you? That's interesting.
So in the night guard, basically, it's really important when a person sleeps that they can close their lips.
Okay.
They can achieve lip closure because we want nasal breathing. We want to encourage nasal breathing.
And why is that?
Nitric oxide, very healthy for
Okay.
you while you're breathing, for one. Also, you're going to sleep better. So getting patency or like air to pass through your nose with your mouth closed is like really important for people.
Okay.
Yeah. So, and that's a whole nother topic, right? Like how are we doing? Like what are we doing to encourage nasal breathing? This is kind of like a sleep apnea conversation. But as far as like a night guard goes, when we take out the 4 front teeth in the night guard, so that what I like is you don't really need to have it come out over in front of the front teeth. That makes it excessively big.
Yes.
In the front, it's kind of unnecessary. You can trim that part of the night guard, and so its retention is on the sides.
I see.
On the middle side.
That would probably be a lot more comfortable for people too.
Yep, absolutely. So that's my favorite design. That's my preferred design. And what you really need to do is keep your teeth from locking in or getting locked together. So when you bite, your teeth nest with each other, kind of like gears engage and disengage. When you engage those gears, upper and lower teeth, the body usually has like a adaptive response of clenching, maybe grinding, and that's to maybe figure out what is the most comfortable, because of maybe an imperfect bite. Maybe there's an interference that can cause clenching. Your brain's basically just trying to figure that out in an adaptive response. So a night guard is going to keep that response turned off. So it'll separate the teeth. Not only will it brace your teeth together to protect them, but it usually turns off that adaptive response.
It does? Really? Okay. Because I notice I still clench against my mouth guard.
Yep. So some people will still clench, and that's a kind of like level 2. So those grinders or clenchers that are doing it with their night guard, are difficult.
I'm difficult. I know.
It's difficult to stop. Yeah. You're one of those people.
It's like a pacifier, where you're like, so I shouldn't do that.
Right.
I should train my brain to stop doing that.
Yeah. I mean, I think I heard from John Coyce, the legendary dentist, say that it's a American Express night guard because you don't leave home without it.
Right. Yeah.
Right?
Yeah. I never leave home without mine. Are there night guards made of different materials that can help somebody like me who clenches even though I have a night guard? That's probably why I have so much recession.
Yeah, I think so. I mean, I think that
maybe I need a new mouth guard then. I need one of
we want to
Perry
try
designed.
Right.
Yeah.
We want to turn off that. Maybe what we need to do is make a night guard that's a little thicker.
Oh, yes. Okay.
So that your jaws don't come closer together.
Yes.
If you're a little bit open, then maybe you
because mine are all indented. It's all indented in the bottom now.
Yeah.
Okay, let's do that.
Let's do that.
All right. Good.
Yeah. I could. Yeah, definitely. That's something we should explore.
Okay. Let's explore.
And then you're not going to see effect right away. You're going to see effect
in 20 years from now when my teeth don't look like skeleton teeth.
I know. Just imagine, right?
When I can still feel
not having
confident
teeth.
with a smile.
Yeah.
And that's one thing you told me. You said, if theoretically, if you can find the reason why you're seeing more recession now, like just in the last year, I would say I see more. If we can figure that out and slow that down, you should have the same teeth in terms of level of recession now as you would 20 years from now.
Yeah. I mean, 20 years from now, you're hopefully going to look back and be like, hey, I haven't changed very much. My teeth have been preserved, right?
Yes.
That's the goal.
Yeah.
Right. Preserved from damage.
Yes.
There's preservation effects. There's, we all want preventative dentistry, preventative medicine. But there's also preservation.
Yeah.
And
that's
so
huge.
Preservation takes a while to see the effects, right? It takes years. So some of these concepts we talk about with patients have to do with preservation.
I love that.
Yeah,
Prevention and preservation.
That's it. The two P's, right? So prevention is a topic. Preservation is another topic. Night guards are for preservation. Having a perfect bite or adjusting your bite to will allow preservation. There's other things that we can do for preservation, like habits. How do we toothpaste, non-abrasive toothpaste, not rinsing the toothpaste off. Some of the topics that we've discussed are probably in the category of preservation.
Yes. And the other thing that you brought to mind when I was here last time was actually it was a hygienist who said, think about not closing your teeth together during the day unless you're chewing food, keeping them apart. Something that I'd never thought of in my life before, but I'm thinking about it now.
Yeah, I mean, there's thousands of times a day where we are touching our teeth together, right?
Yes.
Every time we swallow, we usually touch our teeth together. I would challenge you to try to swallow without touching your teeth.
I'm trying it right now. I can't do it.
It's hard to do.
Yes.
So there's going to be a lot of times where your teeth are touching. You want to make sure that there's equal simultaneous pressure on all of them. If some of them hit more than others, most people don't know it,
Right.
Some people do. Some people are more sensitive than others. It's kind of like the princess and the pea, right?
Yeah, right. The princess and the pea. Yeah, exactly. Yeah. And you do that with that paper that you put in between, and then you say, okay, bite down really fast, and then you see the color on the paper. Like, I don't feel any difference, but you see the difference, and then adjust for the difference.
Yeah, I mean, some people can feel that pee through all those mattresses, but other people can't tell, right? Most people can't tell. And so they're doing damage to that one particular tooth, right? Because it's hitting a little bit prematurely or a little bit harder. Or maybe when you do a certain motion, it's sliding.
Yes.
So it's spraining. Because teeth are just like having, 28 different antlers, different horns that are kind of sticking out of your skin, right?
Yes, right.
And so they're a complicated structure. They're way more complicated than hair or eyelashes. And so there's a ligament that's holding them into your jaw, to your jawbone, which is your skull, your upper and lower jaw.
And here's the thing about hair and eyelashes, that as we get older, we know we lose our hair everywhere, except for
our ears,
maybe ears, But we don't want to be losing our teeth. We don't want to be, because you can have a wig or go get some help, but teeth are expensive and necessary.
Right. Definitely.
Everyone in my family, my grandmother, my grandfather, my uncle, my grandparents have passed away, but they both had dentures. And I saw them, putting the dentures in the jar of whatever every night. And then my uncle has gone through, several set of teeth and having to get used to a new set of teeth. And that is the last thing that I ever want to do.
And I think you'll be fine. You're going to keep your teeth your whole life, for sure.
And I'll have you to thank. I'll have you to thank.
That'd
Dr.
be nice.
Perry.
I'd love that.
Yeah.
Maybe you can say nice things about me.
Yeah. At my memorial, when you come to my memorial service one day, you're
definitely.
like, I'm responsible for those great teeth.
Yep. Yeah. I've done that before.
Have you?
I'm very comfortable saying that.
Good. Yeah. And by then, everyone will know you as the dentist to the stars. And they're like, oh my gosh, the dentist to the stars is here to see.
That's right.
Rebecca at her memorial service.
Yeah. Dr. Brummett, who actually started the dental practice, he became a patient many years later. And I got to write in his memorial, which was great.
Yeah.
He didn't want to become a patient of the guy he sold the practice to that sold it to me. But he came back because his kids were in the practice. And they were like, he's also a Navy pilot, Dr. Brummett.
Oh, so you had that connection.
Yep. He lived a long time, probably, I think, into, I think he made it to his 90s.
Wow.
And was golfing every day. I really enjoyed him. So I'm happy to write in people's memorial because of the connection I have. I love that part.
Stand up and speak since you're such a great speaker. That's what I expect.
I learned from you.
Okay.
Best. I don't mind giving the credit. It's great.
Yeah.
So, no, I'm working on it every day. The funny thing is I still feel like I need help speaking. Maybe we all do.
You know what? And that's a good feeling
Mm-hmm.
because I feel that way.
Okay.
Like there's always room for improvement.
Right.
Always, always, always.
Mm-hmm.
You know, there's
Okay.
when you think about a presentation that you've given,
Mm-hmm.
there's an old saying for speakers. There's actually 4 presentations that you give every time you give one. It's the one you plan to give, the one you actually gave,
Mhm.
the one the audience hears, and the one you'll give next time.
Nice. I like that last
Right?
one.
Right. Yeah, me too. The one you'll
Yeah.
give next time.
My dad passed away about 6 months ago.
Oh.
It was, I think, just before his birthday.
Oh, wow.
And we just had the memorial service last weekend.
You did.
Yeah. I should have called you and got prepped for that speech, but I did think about you and delivery. I tell you what, I knocked it out of the park. It was great.
I'm sure you
So
did.
I'll share with you the recording.
Yes, please.
Does that sound good?
Yes. Yeah. Were you
if
here
I can
in
find
town?
it. It was recorded. No, it was in Cedar Rapids, Iowa.
Oh, okay.
Yeah.
Okay. I'm sorry for you.
Oh, thanks. Yeah. He's great. I think he did pretty good. And so we got to celebrate my favorite part was passing around the microphone and hearing all of his friends.
Yes, the stories.
Yeah, things I'd never heard before.
Exactly. Yes.
So I think it's important that we show up for people.
Yeah.
In memorials, and speak up. And use our words to honor them.
Yes. Right.
So I was able to do that last weekend. So
how
it was
meaningful.
a good time.
How meaningful.
That was my last speech. In front of more than one person.
I would love to see the recording.
Okay.
Yes.
Yeah, great.
Please
Let's see
share.
if I can get it. Yeah.
Okay.
It was recorded, but I just have to go dig for it.
Yeah. Okay. Somebody got it on their phone or something.
Yeah. I mean, somebody got it. I think the church where the memorial service was in Cedar Rapids, Iowa.
Yeah.
Recorded it,
Okay.
but I don't know what happened to it. I got to ask my sister. So this has been wonderful. Thank you, Rebecca, for being here. And I want to share with everyone that you have a website, RebeccaMurray.com.
RebeccaPMurray.com. There's
Okay,
a P in the middle of Rebecca and Murray.
Mhm.
And then also showcaseyourshine.com. Both go to the same place.
Okay, great. So yeah, Showcase Your Shine really encapsulates, what you do.
Thank you.
Yeah. And so I just want to highlight that we are customers and
We're customers of each other.
yeah, exactly.
Yes, we are.
And so it's added so much to our business. And so I just want to say thank you and thank you for being here. I hope we can do this again sometime.
Yes, me too. It's been my pleasure. And thank you for educating me about how to care for my precious teeth.
You're welcome. Hey, thanks for watching the Blake Perry podcast. Please tune in next time. We're going to talk to some other interesting people, both from my practice, people that have all kinds of talents. And I think next week we're going to be talking about 3D scanning and finding out a little bit more about AI in dentistry. So we'll talk to you then.